benefit of using data coming from the critical care unit is really the volume of data. So you have a lot of high resolution data. You have many data streams, 8, 10, 12 simultaneous data streams collected from a small set of organ systems, the heart, the cardiovascular system, the respiratory system, some of it from the brain. So you actually have a lot of simultaneous information about the same organs. Some of it is redundant, but that redundancy might actually be very helpful, meaning that, you know, if you can get information from different sources, you can actually compare and see when that information content is actually diverging. So the benefit of being in that environment is that you can actually test out these mathematical modeling approaches with a lot of data. Ideally, or eventually I should say, the approaches that we develop, we hope to actually migrate out of the very specialized care environment of the intensive care unit, simply because it's a very small fraction of patients who end up in ICU care. And you would like the tools that you develop to be used as broadly as possible. So for example, with the project on intracranial pressure monitoring, we currently are using it in the neurocritical care unit because that's where you have the invasive measurement available. So if you want to do validation studies, that's where really you have to go. But eventually we actually see this measurement, once validated and sufficiently accurate and robust, migrate much, you know, out of the neurocritical care unit to a much bigger patient pool that is not just those with severe traumatic brain injury or a hemorrhagic stroke. So if you go into a hospital environment, right, you see big devices, right? These usually come in the form of small fridges that get pushed around on a cart, you know, from one patient to the other. But if the microelectronic revolution has shown us one thing over the past years, is that devices like this, right, have a lot of computing power. I mean, it's incredible how much memory you have and how much computing power you have at the palm of your hand, essentially. And one of the idea of our work in conjunction with the Medical Electronic Device Realization Center is to bring that same increase in power and capability with the same reduction in form factor to the medical device space. So in the context of the work that we're doing in intracranial pressure monitoring, one of the variables that we need is cerebral blood flow velocity, meaning that you actually have to estimate or you have to measure the velocity at which blood flows in the arteries in your brain. The way that you measure it is with ultrasound. So you can actually shoot ultrasound through your skull and it bounces off red blood cells that are moving, and you can analyze the signal that's scattered back to your transducer and you estimate the velocity. There again, you have a device which is either the size of a small fridge or maybe, you know, the size of a small suitcase. And you have a big head frame that you have to put on currently. And looking at that technology, and you need an operator actually to steer the beam and to make sure that you're in the optimal location. So looking at that technology, there's actually no reason for this kind of science. And there's really no reason for the need of an operator. So by miniaturizing the electronics, by putting all of the algorithms in the front-end electronics, and by miniaturizing the form factor, we hope that we can actually make that particular measurement as easy as putting on a gel electrode when you measure an ECG. Well, it's just that you actually put it here and that there's going to be a lot of electronics in the front-end sensor that would then allow you to apply that in your home or in a doctor's office, in a pediatrician's office. That doesn't require a specific skill. But all the skill and all the work that has been done by the operator would be encoded in the electronics and would actually be done by the electronics. So I see a lot of opportunity to actually reinvent medical devices and take it out of a specialized environment of the hospital into the home of patients for home care and for less expensive care, quite frankly.